For exercise number 2, we are going to be using a resistance band, and we're going to be putting it around the feet. And what we're going to be doing is what's called a monster walk. So we want the tension on the band, so we don't want our feet completely together, that there's slack in the band. We want our tension in the band. What we then do, hands on hips, again we have a little brace of the abdominals. It's not a heavy brace, but we are just bracing the abdominals, and then we take a step forward. It's about half to 1 foot length forwards, and then we take another one, and then we take another one, and then we take another one. So that's the exercise of the monster walk. Now, like the bridge, there's a few things that we need to be able to do. So the action, or the role of the muscles within this exercise, is to hold the foot in a nice straight line. So where in the bridge we were looking at the big glute max muscle at the back, what we're now doing is we're looking at glute medius and glute minimus on the sides. Now their role, as I mentioned, is to keep the foot in a nice straight line. Because what happens is most people, and they'll go like that, so as soon as they lift the foot off the floor, the muscle doesn't engage, it doesn't come in and hold the foot in place. So there's a moment where it's then got to catch up, and that's where the foot comes in, and then it comes back out like so. So they engage it as it comes back out. So it disengages on the way in and engages on the way out. Now again, that's only a split second. So what we want to be able to do is get the tension on the band, so the band wants to pull the foot in. What we're then able to do is come forward in a nice straight line. So as you lift, if you find your foot coming in and out like so, a nice easy fix for that is when you lift, aim to push your foot out. So although your foot won't go out, it will, because it wants to come in, but you're pushing out, it should stay on the same line. So as you come up, you push out, push out. So you're pushing your foot out as the band wants to pull it in. What that then allows you to do is come out in that straight line. So we're in this position. Again, it's only a half. If I go onto the side, you'll see, with regards to the body, slight bend of the knees, slight flex of the hip. So we're in that sort of hip hinged position. What we then do, step out. Again, you can see it's about half to 1 foot length, half to 1 foot length, half to 1 foot length, half to 1 foot length. So we would take those steps and we would go out. And what we're doing with this, with these, well, certainly this exercise, but the other 2 exercises, is we're stabilizing the pelvis, which then brings stability to the lumbar spine. So if we want to build the lower back, hip exercises are essential for it. If you're just focusing on multifidus, longissimus, the erector spinae type group, the QL, if you're just focusing on those, you're not going to be as in a good place as you would be if you included the hips. So again, we've got hands on hips, slightly flexed, we got the abs braced, but only a light brace, and then we would walk across, turn around, walk across, and the whole time we do this, we want to be able to keep the feet in line so they're not going in and out. So the second exercise is the monster walk, and it's not necessarily a sort of a repetition type concentric eccentric contraction. It's more of a static contraction. So we want to be able to hold the feet in place, and the best way to do that is with a band around the feet, get your tension and perform the monster walk.